Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to discuss the question of, can I walk too much that it actually harms or damages my knee replacement? So can you do too much walking, too much activity where it causes harm or damage to your new knee? So first of all, yes, you can do too much activity and can cause harm and damage to your knee if you're doing excessive amounts of activity. Now, this is things that are going to put a lot of stress and strain through your knee replacement. So things like running, things like cutting and jumping and plyometrics, really excessive amounts of weightlifting. Those are the things that are really going to lead to breakdown of the knee replacement over time and increased risk of loosening of that prosthetic and needing a revision surgery. Now, in the short term, as you're recovering and healing from surgery, you're probably going to have too much pain and discomfort and swelling anyways to really do any of those activities. But walking is a little bit different. So walking there is some stresses, there is some pressure and forces that go through the knee joint when you're walking, but it's relatively less compared to those activities that I just described. And for the vast majority of people, the benefits are going to outweigh the negative risks of causing any actual damage or harm or injury to anything. Now, what I do want to discuss though is you could do an activity such as walking or maybe something else such as hiking or biking or swimming, gardening, whatever it may be, and you may get a flare-up of symptoms. So you may get increased amounts of pain or swelling or stiffness or just all of that combined. But the thing is, just because you're having a flare-up of those symptoms, that pain, discomfort, swelling, doesn't mean that you're causing any damage or harm to the prosthetic. It just means that your body, still hasn't adapted and maybe is not able to tolerate that much of that activity right away. The threshold to have those symptoms, that pain, that warning signal from your body, and the threshold to have actual damage are very different. So it's a lot more to actually cause damage and harm and injury to the body. So walking is perfectly okay to do. If you are getting those flare-ups of pain, the best thing to do is look at the parameters. So look at the intensity. Are you doing very brisk walking, or are you doing just a kind of a normal, moderate pace? Are you walking on a hard surface or on a softer surface? Do you have good footwear? How frequently are you walking? So are you walking multiple miles, multiple times per day? Are you walking a couple times a week? Those are the parameters and things that you want to play around with to get to that comfortable level. It's all about finding the happy medium where you're doing enough activity to have the positive benefits of building strength and building endurance and good cardiovascular health and aerobic exercise, but also not too intense where you're causing those flare-up of symptoms that's going to set you back a little bit. So it's about finding that happy medium. So it's not going to cause any harm or damage, but it may cause some pain and discomfort, and you just have to play around, do some guess and check to find the intensity and the frequency that works well for you and your knee replacement. And this will vary. Early on this might be a lot less, and then as you heal and recover, you'll hopefully be able to tolerate more and more. So I hope this was helpful. If you did find it helpful, be sure to leave a like, leave your questions and comments below, and I get back to everyone I see. And of course, be sure to subscribe and turn on the notifications so you can catch every time we post a new video related to knee replacement surgery, exercises, frequently asked questions, everything else in between. Thank you very much for watching.